Hello, friends. I'm Dr. Arpana. I'm a practicing homeopathic consultant. In this channel, I talk to you about the role and scope of homeopathic medicines in the various medical conditions. As you must be aware that I do have a Hindi channel as well, and on demand of my viewers and my subscribers, you all requested me to make the videos in English as well, and that is the reason I have started with the English channel also, and I have also posted some of the videos to this channel. So today it is World Hepatitis Day, and this day is observed as a day to spread the awareness about hepatitis. Now, today is the birthday of a Nobel Prize winning scientist, Dr. Baruch Blumberg, the person who discovered the hepatitis B virus. Now, as the term hepatitis, what does it mean? So, it means there is some kind of inflammation with the hepatocytes, or hepatitis means the liver. So, hepatitis is the infection or inflammation pertaining to the liver cells. So, this disease is the disease of the liver. Now, hepatitis, or the inflammation or the infection of the liver, it can happen because of some viral agents, or it can happen because of some toxins, or maybe it can be the result of overuse of alcohol. So today we will be concentrating more on the viral causes. So the viral causes could be hepatitis A, B, C, D, or hepatitis E. We are more concerned with the hepatitis B and C. Hepatitis B and C, they are like related with the increased morbidity and the mortality, and this is also one of the major reasons of hepatocellular malignancies or hepatocellular carcinoma. So today we will be focusing more on the B and C, and like how do the hepatitis B it is transmitted, what are the symptoms, and most importantly, what homeopathic medicines can help in such cases. So, before I start with this, if you are new to my channel, before watching the video, do not forget to subscribe to the channel, and also you can hit on the bell icon. If you wish to ask questions from me in the live consultation, you can do so. You just need to subscribe to the channel, and then you can ask your questions through the live chat. All right. So, first of all, let us understand about the viral hepatitis, the hepatitis B and C. Now, how it is transmitted. So, this is transmitted through the blood route. So, if somebody is using some infected needles or maybe some medical equipment from one infected person to a healthy person, then the healthy person is predisposed to the infection. It can also happen from the saliva. So if you are using like some toothbrush which is used by some infected person, again it can be a factor of getting the infection. It can also spread through infected razors. It can spread through unprotected physical relationship. If an infected person is having unprotected physical relationship with a healthy person, then that person can also get the infection. Now, one more important mode of transfer or transmission will be the vertical transmission, which means from mother to the child. So, this is also a very, very important method of transmission of the hepatitis B and C virus. Now, what will be the symptoms? So now the hepatitis B virus will have some acute symptoms, and when the acute symptoms they are maybe the person is not having the acute symptoms anymore, but the virus is still inside the body, then it can be a reason of the chronic inflammation of the liver cells of the hepatocytes, and this chronic inflammation can later on develop into the liver scarring, fibrosis, or hepatocellular carcinoma. Now, the acute symptoms will be the acute insult to the liver cells. So, there will be symptoms of jaundice. Jaundice is marked by the yellowing of the white part of your eye, there can be itching, there can be loss of appetite, there can be flu like symptoms like extreme fatigue. The person will experience extreme fatigue. Along with that, there can be stomach pain, especially on the right side. And along with this, there will be dark colored urine, and the stools will be somewhat whitish or light colored or clay colored stools. So on one hand, we see that the urine is dark colored and the stool will be light colored. At the same time, there can be severe itching also. So these will be the symptoms of the acute symptoms of hepatitis. Now, most of the time, what happens is the person can actually get rid of the virus and the person is absolutely fine. But in some percentage of the patient, we will see that this acute hepatitis, the symptoms or the acute episode will get over, but the virus is still replicating inside the host body, and that is what is giving rise to the symptoms of chronic hepatitis. Now, how do you find it out? So you can do certain blood test. The surface antigen test or the Australian antigen test can detect the presence of HPV, and then accordingly we have to basically treat the patient. So whenever like a person is having the infection or a person is getting infected with the hepatitis B virus, the longer the duration of the virus inside the host body, the bad will be the prognosis. So, for example, if a child is getting affected by the virus, the child may not get the symptoms right during the childhood, but the virus is basically replicating and growing inside the body, and then a point will come when the overt symptoms will come out. And that is basically showing the chronicity of the hepatitis B virus. So, if a person can overcome the acute phase and like he is absolutely all right, and there is no traces of the virus inside the body or the viral load is less, then there are very less chances of that person to progress into the further complications or go into the liver scarring or the liver fibrosis. But if the viral load is still there inside the body and maybe the viral load is increasing, the virus is replicating, then that is making the host body favorable ground for the like further complications to happen. So it is very very important for us to do the test and to do the basically the routine test and repeat the test as well, just to make sure that the viral load is not increasing in the body and the symptoms they are also under control. So now we will be discussing about the homeopathic medicines which can help. So I do plan to make a video separately discussing about the homeopathic medicines which are very very useful in the liver affections. So today I will be telling you the name of some of the medicines which can help. So the first medicine that I would like to mention is chelidonium. Now, this medicine chelidonium, it is a very, very good medicine for the liver, especially when we see that there is always some dull stomach ache, there is loss of appetite, the stools, they are light colored. Chelidonium medicine can help, and chelidonium is better when taken in lower potencies in mother tincture. The next medicine for liver affections, it could be carduous. Carduous is also a very very good medicine, especially in case of portal congestion. Then we have medicines like calmake, again in mother tincture form. So chelidonium, carduous, calmake, we have to take them in the mother tincture form. So mother tincture means it's a liquid medicine. You need to add 10 to 15 drops of the medicine in about half cup of water, and you have to consume the whole water. Now, the other medicines could be Macphos. Macphos in 6-6 potency can help. So, you can take 4 tablets 3 times or 4 times a day based on your symptoms. Then we have Natrum Sulph. Natrum Sulph is also a very good medicine for liver related affections. Then we have medicines like lycopodium, we have china, we have sulfur. So all these medicines, they can actually help the liver cells to come out of the injury. They can actually heal the liver cells, the liver tissues. Homeopathic medicines, they are always based on the symptoms of the patient. So it is very important for us to understand the symptoms, how the symptoms like they aggravate, how the symptoms, the patient feels better, what are the aggravating factors, what are the ameliorating factors. So we need to consider the patient as a whole, and then we have to prescribe the medicine, and then we can expect really good results from the homeopathic medicines. So these are some of the medicines which can help. Of course, we have other medicines also, and as I said, I will be making a separate video explaining about the role of the homeopathic medicine, especially for the liver affections. So I hope you have enjoyed the video. So do not forget to share the video with your friends and family. You can leave a comment in the comment section below. If you are new to the channel, do subscribe to not miss any of the information that I share with you all about homeopathy in this channel. Always remember, when a healthy mind and a healthy body resides together, diseases disappear. Thank you so much for watching. Let's learn and use homeopathy with me, Dr. Arpana. Thank you.